This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, from Philadelphia to Erie and from Scranton to Pittsburgh, it's Behind the Headlines. I'm Charlie Greenawalt, Senior Fellow for the Susquehanna Valley Center for Public Policy. And Maura Donnelly, my normal co-host, is on assignment today, but I'm joined, as usual, we've been here many times before, by Jere Strittmatter. Jere, welcome to the show.
Hi, Charlie. Thanks for the opportunity.
Of course, Jere, you are not only a member of Susquehanna Valley Center's board, but you're a former state legislator from Lancaster, former state House member, and you are a former chief of staff for the Speaker of the House.
I've been very fortunate over the years to have all these learning experiences.
That's a nice way to put it, Jere, yes. Interestingly enough, Pennsylvania politics is changing as we speak. Now all of a sudden we have a new candidate for governor. Mike Turzai has announced, the Speaker of the House has announced, and Scott Wagner, Senator Wagner, has announced that he has a running mate as well in his attempts to deal with Paul Mango out in Pittsburgh. What does all this look like to you?
Well, Pennsylvania is always a trendsetter, and it's like the water's warm, everybody come on in. And so it's great for people to be able to express their views and to get out and do something about it. It's a lot better than having no candidates. It's a lot better to have people talking about the issues like we are today with our important guest.
Mm-hmm. We'll certainly have a lively Republican primary for the governorship coming up.
And Democratic primary too, Lieutenant Governor, and what's going to happen there.
That's true, Jere, that's true. But today we're lucky enough to have a very good guest with us. We have Paula Bussard, who's the Chief Strategy Officer for the Hospital and Healthsystem Association of Pennsylvania. Paula, welcome to the show.
Thank you. Happy to be here.
This is your first time with us.
Yes, it is.
And we're very happy to have you. And it couldn't be a better time for you to be here because I don't know about Jere. I think Jere's community is the same as the community that I live in, where there's a lot of confusion, there's a lot of apprehension about health care coverage. Right now there's so much confusion in Washington, D.C. In regard to the health care debate. What can you tell us about what's going on there and where are we heading in terms of health care coverage in the country?
Well, first off, there is debate going on in Washington, D.C. about the Affordable Care Act, which, remember, expanded Medicaid for very low-income individuals, and then also offered on a health insurance marketplace private health plans for individuals who are working but at jobs that either don't pay enough to help them purchase health care or the employer doesn't offer health care. So while they're debating whether the individual mandate is retained or not, it's important for everybody to know the law still exists, health care coverage options are still available. And for individuals, they have until December 15 to enroll in the federal health insurance marketplace, or if they're already in the marketplace, to change their health plan. And so we're saying to people, get educated, do it early, don't wait till the last minute, and talk to family and friends and do your research so that come December 15th, you've made your selection if you're an individual, and then January 1, you would have your new health plan.
Well, thank you very much for alerting all of our viewers, to this, how important this is. And I know, because of all your good work over the many years working with the association, all your members, you have a lot of information. And if people want to get that information, what website or contact, should they go through to make sure that they get the help that they need?
Well, we have resources available, information resources, and then also links on our website at haponline.org. But the state Pennsylvania Insurance Department also has some very good information, because one of the things that's really challenging as the federal government changes how the Affordable Care Act works is what are the plans that are available? What are the monthly premium rates? What's their provider network? What's your out-of-pocket? And the Pennsylvania Insurance Department also has a very good tool, the Consumer's Checkbook, to be able to do some of your preliminary research to see, would you be financially better off in a different plan or with a different benefit package?
What will what will enrollment look like in 2018, Paula? Will there still be, you said up till December the 15th, but is there a chance past that point? What about 2018?
Well, you would be choosing a health plan for the entire 2018 period. So the way the federal marketplace works, it is an annual enrollment. If you get your insurance through an employer, oftentimes at roughly around this time, they're giving you selection as well. So the timing is somewhat similar, because if the individual subsequently gets a job where there is insurance, they can make that change. But until Congress acts on the tax reform, whether they include repeal of the individual mandate or not, it's hard to predict what January 1, 2019 will be like. But for now, there are health benefits. If you are low income, you may be eligible for subsidy. If you want to check whether your income is so low that you're eligible for subsidy, you do have to go to the federal website, healthcare.gov, because that's the vehicle by which you will qualify for the subsidy or not. And in fact, roughly 80% of Pennsylvanians who are insured through the marketplace are receiving some financial assistance that reflects that their income is just way too low to be able to afford health coverage on their own.
Correct me if I'm wrong, but I think the important factor is now that we're facing now November 15th, December 15th. Deadline will be here, but worrying about all the what's going to happen now and what piece of legislation, the important part is that people are misguided when they look at the laws of probability and the law of averages. And the fact is that you and your members do a great job providing health care to all of us, but in order to do it efficiently, everyone needs to have insurance. And the fact is that when you go in to buy the lottery, you think you're going to win that on that side, when really your chances are like, being struck by lightning twice, of doing that. But with healthcare, you think I'm never going to get sick. I'm not going to get sick in 2018, so I don't need to worry about that. But it's exactly reversed, and that's why it's important that everybody, they have a choice. They either need to go through the government plan, get the subsidies, or private, but everyone needs to act to make sure that they're covered in some way for 2018, correct?
Correct. And that's still part of the law, but it's really more of a common sense. I know that, like you said, we are all going to use healthcare. Sometimes we just don't know where we're outside, we fall, break a limb, or a disease takes place, or a family where a child may be ill and it's more complicated than one would like, or a diagnosis of cancer. Everyone having health insurance means that they have access to physician services, that an emergency situation is not going to financially devastate that individual or family. But also with health insurance, one of the things the data really shows is that individuals with health insurance are more apt to get primary and preventive care. If they have a chronic condition such as asthma or diabetes, they are better able to manage it by having that coverage that enables them to see physicians, primary care specialists, or other types of providers. So really, everyone needs to have it. Seniors have Medicare, very low income individuals Medicaid, and the rest of us either through our employer or we can go through the marketplace as individuals to get health insurance.
Paula, no one works more closely with Pennsylvania's hospitals than does your association. Just wondering if you have questions and if you're seeking coverage, what help do hospitals have for you? Can a person seek information and answers at their local hospitals?
It's a good place if you don't really know, if you're very confused, a good place to start would either be on the internet for the hospital's website to get their financial aid number, or to call and ask to speak to a financial aid representative. Some hospitals are able to help you enroll, but in many cases they know the specific organizations They're called navigators, and they know where they're located to be able to say, you can go, for instance, in Harrisburg to Hamilton Health Center, or in Philadelphia to Temple University Hospital, so that people who will help you sort through that complexity based on where you live, based on your income, based on your health needs.
Many hospitals have professional social workers as well. I guess they're available, I suppose, to help in some instances as well.
Absolutely, and typically the social worker is going to probably refer you to a financial counselor, somebody who, for free, no charge to the individual, help you sort through the complexity. But the bottom line is, don't wait till December 15th to do that. There will be that last minute rush, maybe the system will be overloaded. Good news is, this year, even though the time period is shorter, what the federal government is seeing on the marketplace is that more people this year at this time have enrolled than last year. So people are aware that they've got to make this decision. We also encourage people over the coming holiday period, when they're with family and friends, is to ask, did you enroll? You know, are you in a health plan? Do you know about the federal marketplace? It's a good time, particularly if there are young people at the Thanksgiving dinner, to make sure they understand that they aren't always invincible and that health insurance is important to have.
And you and your association, maybe you can brag a little bit about yourself now in the last minute or two that we have, but how extensive that is and how you've done a great job with adjusting to all the unknowns and all the changes, and how better off we are. But the preventative health is so important, because when you wait to the emergency room, you know, you're looking at really dire consequences besides the financial things. But I've seen some statistics where 50% of people would be helped if they were following up with healthcare providers all the time. Isn't that correct?
It is, and one of the sides of the Affordable Care Act that a lot of people aren't aware of is there was a lot of changes that were made with payment incentives to help hospitals and doctors do a better job of preventing hospitalizations, making sure that people who are discharged get the care that they need in their home, to prevent readmissions, to work on preventing diabetes, asthma, other heart disease. So you see a lot of that going on as well. And definitely, you are far better to take good care of yourself and work with your providers to manage that, so that if you do develop a chronic condition, it doesn't become devastating and where you have to be hospitalized.
So if someone, for example, would have a son or a daughter in college and they were enrolled last year, they have to enroll again.
Yes, they do. However, what
I think
will
there's
say,
a lot of my college students don't know that, Paula.
What I would say is the Affordable Care Act does allow young adults up to age 26 to remain on their parents' health insurance.
Right.
So if the parent has an employer-based coverage, that young person can be on their insurance. But if the parent doesn't have that coverage, then yes, that 20-something young adult needs to enroll. Now, there are a lot of options, lower priced monthly options. Also, probably their income isn't so high that they might qualify for the subsidy to get a health insurance plan. But it's important to have it.
Thank you so much, for providing our viewers with this important information,
Well, thank
today.
you.
And it's so timely. So thank you.
We want to thank you and Paula and the Hospital and Health System Association of Pennsylvania. And we look forward to a future guest from your association in the not too distant future. Stay tuned. We'll be right back with Behind the Headlines after this.
Behind the Headlines is brought to you as a public service by the Hospital and Health System Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Chamber of Business and Industry, Pennsylvania Chamber serves as the frontline advocate for business on Pennsylvania's Capitol Hill by influencing the legislative, regulatory, and judicial branches of state government. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Hi, welcome back to Behind the Headlines. On this segment, Jere and I are fortunate enough to have a good friend of Behind the Headlines with us. We have Mike Brubaker, former senator from Lancaster County, who's now and has been for some time the president and CEO of Blackford Ventures out of Lancaster County, Pennsylvania. Mike, welcome back to the show.
Charlie, Jere, it's always great to be with you. It feels like like my living room, feels like home.
Yes. Well, we're looking forward to hearing new things.
Okay, wonderful.
Well, and what do we like to talk to you about the most? We like to talk to you the most about economic development and about innovation and entrepreneurship. When we look at this current scene in Pennsylvania and you look across the political landscape and the organizational landscape, what do you see in terms of Pennsylvania being a state that's poised or not poised to welcome additional economic development, additional entrepreneurship, additional innovation? What do you see in Pennsylvania, Mike?
I'm concerned for Pennsylvania. So I had the good fortune of being in the state Senate for 8 years. I enjoyed every day of that. I chose to not run for a third term. Now, as you said, I'm in private sector. And I'm in private equity, kind of like private banking. So I'm dealing a lot with economic development from the private sector. When I was in state government, I chaired the Senate Finance Committee, and I also had the opportunity to interact with other members of General Assemblies from across the nation inside of NCSL and CSG, and I appreciated those opportunities. But what dawned on me when I was in the General Assembly, and it's really compounded in my mind over and over again, is that there clearly is, and there needs to be some level of separation between government and private sector, of course, but we can do better at bringing the two together, I think. And by bringing the two together a bit closer for a productive, ethical, financially sustainable relationship, I think we're all going to be better. An example, the United States Army under Eisenhower came up with the belief that the military is essentially only talking to military all the time. So they started a program called NSS, and I went through this program, where they bring in civilians to talk with military. And that allowed the military to understand the civilian mindset and the civilian to understand the military mindset a bit and kind of break out of some of those traditions. I think the same thing applies to government, in part. Government many times is just talking to government, and they're not extracting enough value that the private sector has to offer. And I think we need to find innovative ways for the private sector to feel more comfortable in talking to their government leaders and offering up, in what some cases is confidential or proprietary information, to make government work better.
So a good example would be the liquor control system that we've had. You know, there should be control because of the substance. It's alcohol and other drugs. You know, we have a drug problem. However, should we be in the retail business of that? And that would be the same you're saying now with putting deals together that help people with the local governments and with state governments and federal government. You're seeing that this would be better to get the government in the regulation part, making sure it's not a monopoly, making sure antitrust, those kinds of things, but unleash the rest, you know, from the government that's sort of maybe overbearing. What would you call it? Or how do you think this would be set up?
Well, I liked your example, and it's a valid one. Pennsylvania should be in the liquor control business, but not. We're only one of 2 states, I believe, is the fact. That's really a true control state for liquor, where and ownership, where the state is buying the liquor and selling the liquor to the people that ultimately sell to consumers. I think we need to get out of that business. So that's a great point. So how would it work? Here's an example. And this will sound a little bizarre, a conservative Republican saying we ought to start a new Department of State Government. But we ought to start a new department of state government and call it the Office of Innovation and make it 2 or 3 employees. Make it an office smaller than the studio that we're in right now. And the only role those government employees have is to listen to private sector, entrepreneur, innovative ideas that would not normally come in the door, and offer those entrepreneurs some level of protection or confidentiality of their concept. Without the confidentiality of the concept, they're not going to come in the door. So what happens if a Bill Gates of the world or a Joe from Lancaster County working out of a garage has a really cool idea that could generate a few $100 million? That's a lot of money to people listening. That's a rounding error in state government, a $32 billion budget. But whether it's a few $100 million or $1 billion additional revenue to the state because of this new innovative concept that state government's never thought of. So these concepts are out there in the private sector. They're not bringing them in because if they do bring them in, their idea is no longer protected and they don't have any competitive advantage. I think there's a way for us to bridge that gap legally and ethically and inside of the current government rules.
This is something that we'll read about all the time in Governing Magazine, for example, and many of the other government publications that are out there about government, Mike, how we can make government more efficient, more effective, more innovative. I like your idea very, very much.
Well, another problem we have in the state government in some cases, bids, you're doing a road construction project or whatever the issue, you go and build a building. In some cases, the entity has to take the lowest bid. Now that makes sense on the surface, right? So let's call it a $120 million building. And somebody comes in and maybe it's a $130 million, $140 million bid, and maybe there's a $109 million bid. And in many cases, that entity has to take the lowest possible bid. Well, sometimes you kind of lose. Sometimes you're saving $1 in the construction cost, but you're going to end up spending twice as much on annual maintenance and repair. And sometimes, governments aren't thinking about that. And if you unleash the private sector thought process,
government has a mindset that you got to do things just the way they've always been done. Jere's been involved with something in Lancaster, for example, with Clipper Stadium, with the Barnstormers, where you would have, say, public facilities, and it's a ball field, and it's used as a ball field, and that's it. But there are a group of people who not so long ago said, well, in the wintertime we can use this too, and we can open this for ice skating, we can open this for sledding and other things.
This year's movies, outdoor movies in the fall.
Yeah, and have other experiences in there, and that just hadn't been done in the past. And now there are some innovative people who've thought, well, we can get additional use out of this facility.
Well, another great point. So public-private partnership to the Lancaster Barnstormer Stadium that Jere was very pivotal in. It's a beautiful facility even today, even though it's got some age to it, but it's maintained exceptionally well. It's just a great, wholesome place. And you're right. The only way, how do you make something like that pay? Baseball alone doesn't necessarily get the job done. You have to have, so they now have brought in some of the best and the smartest people to own the team and to run the franchise, and they're doing a fantastic job of promoting and making the thing cash flow.
Well, like yourself, before public service, I know worked with you with the ag issues, and you were very instrumental in bringing people together, to come up with good ideas, and those meetings led to many innovative things. So this is what you're going to try to do now. You see that same need of bringing people together, and they just need to be protected, while they do that. Like for instance, we have a lot of farmland that's ag zones. We have a lot of state parks that maybe they could be used in different ways that would also be a revenue generator, so that the schools could be paid for by those dollars rather than having people never own their home, they only rent it from the school district.
Right.
So is that what you're trying to get to?
Very, very much. Yes, very much so. So here's how it would work. You're both working for the Office of Innovation, right? I come in and I ask you to sign a confidentiality, and in doing so, my concept is protected. You're not going to give it to my competitors after I leave. And there's an understanding that you'll only accept my concept if it's good for the Commonwealth of Pennsylvania. if it meets all the laws and the ethics, and it can make the Commonwealth of Pennsylvania more profitable. After you analyze it, you realize no one, to your knowledge, no one in the state government's ever come up with this concept, so it's unique, so it passes that test. Because if someone's already working on it in the state government, you're going to reject me. You say, Mike, we already have this in the pipeline. But if it's new, innovative, not been thought of, generates money, if you hit the go button, maybe you'd have to go through a legislative approval, and the governor would need to sign off in the end, but maybe, that's just by this example, it will bring in $500 million of new revenue to the Commonwealth without raising taxes. And you like it. Well, what we would want is a 5-year window. So you, the state, you're going to make $500 million a year for the next 5 years within this example. And it's a real example. I'm going to make a little something as a private entrepreneur. After 5 years, the window's totally wide open, and anybody can compete for that unit of business. That's how it would work.
I mean, it reminds me a little bit, maybe the example isn't the best, but manure digesters that were developed in the area of agriculture. Originally, I believe Penn State told my good friend Dick Waybright over at the Mason-Dixon Farms that manure digesters wouldn't work. And in fact, he proved them wrong with his own lab. I guess he ended up funding his own lab for $1.5 million a year, but eventually Penn State came on board, congratulated him, and that sort of changed farming in some profound ways, didn't it?
It sure did. He found a way to extract methane out of manure, animal waste, and methane is carbon and hydrogen, and methane is a greenhouse gas, so left go, it's detrimental to the environment, so he captures it. It's an energy source, you convert it to electricity, so it's a win-win-win the whole way around.
In the last minute, that's all we got, like 30 seconds maybe, how can people get in touch with you, our viewers that have these good ideas or they want to talk more to you about this? How do they get in touch with you?
Well, fantastic. I love conversing about good ideas, and it's Mike Brubaker, and it'd be mike@mwbrubaker.com. Or my cell phone, 717-945-9139.
Great. Thank you very much.
Mike, I feel like we've only begun this discussion. We have to have you come back and talk about this a lot more, because there's so many innovative ideas out there that people would like to share. And we hope you'll share your time with us next week. If you tune in again to watch Behind the Headlines, we'll see you then.